Bonjour tout le monde. Good morning, good afternoon, everyone. My name is Chris Nanda, and I'm a member of the board of directors here at the Ottawa branch of the National Association of Federal Retirees, or NAFR. Um, I'd like to begin by recognizing that the Ottawa branch is located on the unceded territory of the Algonquin Anishinaabe Nation. We extend our respect to all First Nations, Inuit, and Métis people for their valuable past, present, and future contributions to this land and our country. On behalf of the branch, I'm also pleased to welcome you to today's webinar called Eyecare for Seniors, presented by Dr. Harry Prizant. Dr. Prizant is a graduate from the University of Waterloo's optometry program and has over 30 years of experience as an optometrist. And full confession, he's been my optometrist for the probably the last 20 years. And also, he is a big baseball fan. So if you have any issues like with wiping the tears from your eyes after that sad loss on Game 7, uh, maybe he'll have some answers for you. So thank you again, Dr. Prezant, for being with us this afternoon to discuss taking good care of our eyes as we age. It's a subject of great interest to our members, and I know we'll all learn a lot. Now, I want to give a special welcome to anybody here who is not yet a member of the association. We hope that these webinars will inspire you to join us. And to our members, we hope that these webinars will encourage you to maintain your membership. We have more webinars coming up later this month, so you can check the NAFR website to register. I also want to mention that closed captions are available in both English and French. To access this feature, click on the closed captions button at the bottom of your screen. And to translate to French, you can click on the little arrow next to the closed captions button and select the translate option. If you have any questions, please type them in the Q&A box and Dr. Prezant will be able to answer them at the end of the presentation. Finalement, veuillez noter que le webinaire sera présenté en anglais, mais la participation bilingue est toujours encouragée. So that's all for me. So now I'll pass it over to our presenter, Dr. Harry Prizant.
Thanks, Chris. Yeah, I might be yawning a little bit because I took your advice and I stayed up a little late and I watched that Netflix show on the expos. You told me about that. I think you told me about that.
I did, yes.
Yeah. So yeah, another reason to wet my eyes for that. So yeah, we're all pretty sad about all that. So thank you for having me. I've been doing this since 1982. Been doing this for 43 years. Started when I was 3 years old. So yeah, love what I do. Absolutely love what I do, and I'm happy to share anything I can help anybody with any questions. Let me first start off in saying what a basic eye exam entails, and there's three basic areas to an eye exam. It's, of course, seeing how well you can see, measuring the prescription for your glasses, but there's a lot more to that than when people say, "Oh, I don't need an eye exam, I see well." It's also the health of your eye. We want to look inside the back surface of the eye, the retina. We want to look at the front surface of the eye to make sure that all the different tissue layers are good. And then the third thing that we do, which is a really, really important aspect as we mature and as we are very young, is the alignment of the two eyes. Because it's not enough to say, what do you see? What do you see? Goodbye. But how are the two eyes working together? Because if the two eyes aren't working together, that's where the headaches, the nausea, double vision comes in, especially now with the advent of all these computers and phones and all the electronic devices. Causes a lot of strain on the muscle system, and if the muscle system isn't in balance, that could be a source of eye strain as well. That being said, as we mature, things change in the eyes, and there's different aspects to an eye exam as well. I don't have a formal point presentation. I don't PowerPoint. I'm a dinosaur. I'm old school. Pen and paper is good for me, not just computers. So I'm just going to talk and blab around and tell you what I do. And I don't have like I said, a PowerPoint situation. And I'm sorry if I slight anybody with that, with my informality of that. So talking about the eye exam, and we can look at the three basic areas that I said. Vision changes, of course. Nearsighted people, as they mature towards older age, become more farsighted. So your prescription changes very, very much more often. In terms of the health of the eye, let's start from the front surface. The eyes dry out a little bit more. We produce less tears, and the quality of the tears change. Your tears are made up of three basic areas. It's made up of oil, water, and mucus. And the oil and the mucus portion of the tears come from glands in your lids. And the place where the eyelashes come out, that's where the oil gland. Behind there is the other gland. So I can show you my, I don't know if you can you see that, Chris? So there's where the eyelashes come out, that's the oil gland. Behind there is with the mucus gland. So if those get blocked, that can be a form of irritation of the eyes, styes, all kinds of different things called blepharitis, where you have secretions that can cause your eyes to dry out. As we mature as well, your lids are not as elastic on your eyes, and that tonicity, the elasticity of your lids can pull down, and that can cause dry eyes, especially if you wake up in the morning and your eyes feel stuck together. That's because maybe the lid didn't close fully on your eye, and you had some kind of exposure on your eye, and it dries out and your eyes are stuck together. That's another thing. During the day, your eyes can dry out for that, as well as the skin on the surface of your eye becomes looser, and it blocks the hole where the tears drain, which causes a lot of people to have excessive tearing. The hole itself can become blocked from dry mucus. So there's all kinds of things that can happen as we age in terms of the front surface of the eye. And then as we go onto the eye, the cornea is the front part of the eye. Let me grab that. This is a teaching tool that I use in my eye. So there's the eye, and the front surface is the cornea. Behind the cornea is the lens that was used for focusing. Then we go to the back of the eye where we have the retina, which is basically like the film of a camera. So the cornea could dry out, the cornea could start deteriorating, and right past the cornea we have the lens. And the lens was used when we were younger to focus. The lens was very flexible. And when we hit the mid-40s, 45, that lens becomes harder and it can't focus. And that's why we needed reading glasses when we hit our mid-40s in order to help us read, because we lose that focus. And that changes gradually until it plateaus around 60, 65, where that focusing pretty well comes to a stop. Once we hit that ages of 50 and 60, that lens becomes opaque. It's not as clear and it doesn't let the light in. And we call that a cataract. Now, when I started 40 something years ago, people in their 60s and 70s were getting cataracts, excuse me. And now, with the UV light being so strong outdoors, I'm seeing people in their 40s getting cataracts. So sun protection is really, really important for everybody, not only for the aged, but also for kids and for teenagers and the like, because the UV light is much stronger. So there's the cataract. And cataract is the most normal thing that can happen in your eye. Everybody will get a cataract if they live long enough. Some people get it quicker than the others. And again, diet is important, which we can touch on. Remind me, Chris, to talk about diet and the eyes. And then as we work towards the back of the eye, we have a very thick gelatin-like liquid in the back of the eye, right before the retina. Between the lens and the retina, we have something called the vitreous, and it's like a thick gelatin substance that keeps the eye with nutrients, health, and it keeps the structure of the eye. And as the vitreous starts to shrink, it pulls away, and it can cause a little bit of flashing. It can cause some flashes of lights, and that we call as a vitreous pulling away. And inside the vitreous, as we age, pieces of skin, old clumps of protein, old clumps of blood vessels that didn't disintegrate perfectly, start floating in the vitreous. And as sometimes we could be at a red light, or there's a blue sky or a white wall, we see these little kind of spider-like substances floating in front. And that's coming from that vitreous part of the eye where it's floating in the eye and the light hits it and you think you see something. It's pretty inert. If you do see a lot of them, it should be checked. If you see a lot of them associated with flashes of lights, that should be checked too. And then we go to the back surface of the eye, and that's called the retina. And the retina has all the blood vessels, all the nerve fiber layer that go back to the brain and send the messages from the eye to the brain. And the most common problem with the retina is when the area of most distinct vision, called your macula, that's the bullseye where you see the most clearest, that starts to dry up. And you can have two types of degeneration of the macula. You can have a wet type and you can have a dry type. And that's a very normal aging process where the macula starts to dry up and you get all kinds of different deposits into the retina that cause a decrease of vision, cause a distortion of vision. And another aspect of the retina, where we have the blood vessels, they change its composition. Blood vessels can become more brittle, they can leak. The number one cause of that is diabetes. And as we get diabetes in our older life, that's a major cause of concern to be checked every single year. If you're diabetic, it's very, very important to have it checked. It is covered under OHIP, which is another aspect you can ask about later. What is and what isn't covered under OHIP? Good old Mr. Ford changed the rules last September, making it harder to have just proper eye care. And then we come to the optic nerve, and as the optic nerve matures, it can degenerate a bit, and the breakdown of the optic nerve could be caused because of glaucoma. Glaucoma is an aspect where the liquid in the eye doesn't drain as efficiently as it does, and it builds up the pressure, and the pressure pushes back to the optic nerve and pushes on that optic nerve, and the optic nerve degenerates, and you can have glaucoma. One of the ways of getting glaucoma. There's a very slow progressive type of glaucoma, and there's a very acute type of glaucoma. They're very, very different, but either way, glaucoma is when the degeneration of the optic nerve happens, and that should be followed and carefully monitored. There's different ways of correcting the glaucoma. You can't really reverse it once the damage is done. If you catch it early enough, you can help prevent deterioration of the optic nerve by means of drops to lower the pressure, by means of drops to enhance the liquid to flow out easier. There are different procedures where you can put up a little laser hole in the iris of the eye so that the pressure can decrease. There's all kinds of things that you could do. And there's so many new technologies now where we can diagnose glaucoma at early stages. There's all kinds of advents of special testing that we can do that really will benefit in prevention and early detection of glaucoma. And then we have the optic nerve degenerating and the pathways from the eye to the brain center. The brain center is in the back of your eye, called your occipital cortex. That's where the eye center is. And there could be disruptions due to degeneration of the nerves with aging as well. Don't know if I missed out anything else, but that was about 15 minutes or so. Is what I figured I would talk. Maybe we could open up for a couple questions. Maybe you can see what I'm missing now. OHIP, we can go to OHIP if you wish. We can touch on OHIP. It used to be that anyone over 18 to 65 is not covered under OHIP unless there's a medical condition like diabetes, like glaucoma, like a corneal scratch, a corneal dystrophy, corneal aberrations. There are other health issues that are affected the eye in terms of people with arthritis and are taking medication can affect the eyes. All kinds of medication can affect your eyes too, which we can talk about. But anyone under 19, I think, is covered. Anyone over 65, good old Mr. Ford changed the rules last year that if you're over 65, you're covered under OHIP over every 18 months, not every year, unless you have a medical condition, be it diabetes, be it glaucoma, be it cataracts, et cetera, et cetera. So that's under the discretion of your optometrist, and we have to decide what's covered and what not covered. It's very frustrating for us as well, because I think everybody over 65 should be able to come visit their optometrist um, every year. What else did I miss, Chris?
Well, thanks. You did ask me to remind you about the diet in the eyes.
Yeah. So um, you want to be able to be rich in antioxidants. That's a good preventer of the anterior surface of the eye, namely vitamin E, vitamin C. That's going to prevent cataracts, and any antioxidants will be good for most of the eyes, but mostly an antioxidant will be good for prevention of cataracts. So anything that has a rind, blueberries, grapes, those are very high in antioxidants. You want to take other things to prevent you from having dry eyes, and one of the best things to take is omega vitamins. You can find omega in a lot of healthy fatty fish, almonds, lots of nuts, lots of fibers have a very good source of omega. And omega is really, really healthy for the health of the front surface of your eye, especially for dry eyes, especially for any problems with the cornea. The back of the eye, you want to prevent a breakdown of the retina, especially the macular area. You want to have foods that are rich in green leafy vegetables, um, kale, spinach, any colored peppers, the red peppers, yellow, orange peppers have very, very high nutrients in the antioxidants and in a chemical called lutein, which is high in lutein and high in zeaxanthin. Those are very good for prevention of macular degeneration. Um, so that's important as well. Um, Good healthy diet. Smoking, number one cause of problems. Smoking is probably the worst thing for your eyes in terms of macular degeneration, in terms of the retina, the vasculature, the blood flow to the back of the eyes. You want to prevent abundance of sugar, of course, a lot of chemicals, a lot of preservatives in food. Healthy diet is good for everything, but especially it's good for the eyes as well.
Thank you. Just wondering, in terms of whether, before I get to the questions, is there a website or something, a link you could send us afterwards that we could share with people with a list of all these healthy
Mm.
foods? Because that's
Yeah,
that's
well,
a
we might have
very
it on our website. We might have it on our website that can direct you to it. It's Bastian and I
I can check I'll check your website and I
yep,
can send that to
yeah,
Antoine
Bastian
if it's
Prizant.
there. Yeah. When we
Speaking
send
about
out.
Bastian and Prizant, my partner of 37 years passed away a few years ago. His name was Michel Bastian, and his family's been in the eye care profession since 1913. So they're a pretty good stable uh, profession. Proud. I mentioned his name because he was proud of his grandfather who started the profession, Bastian and Prizant. I became the Prizant, of course. So you can look at it on our website, see if we have it. If not, I can direct you to places
Okay.
for it. You
Thank you.
just Google eye health, eye care. It's and also Canada Health website has it on, and that I know for sure.
Okay, well, thank you. So now I'm going to get into the questions, and I was a history major, so I may butcher some of these technical terms. Um, are there any side effects to eye drops? And I have here Mylan, Mylan, latanoprost slash timolol, 50 mcg to 5 smg ml. What
So
are they?
lantanoprost is a drop that you use exclusively for glaucoma. It has a lot of chemicals. It's pretty harsh, but the side effects a lot with medicine, and it usually is sometimes more troublesome than the problem itself. But lantanoprost is used exclusively to bring down the pressure in the eye. So it can cause some irritation, but the benefits of bringing down the pressure is very, very important. You don't take lantanoprost for dry eyes or for an irritated eye. You take that specifically for um, glaucoma. And if you were prescribed that lantanoprost, don't let Dr. Google tell you not to take it. It's important. I'm sure your eye care professional has done it for a reason. Do not stop taking that. You can take a secondary eye drop that will help cushion or relieve any irritation, like an artificial tear. A lot of the artificial tears I'm not a big fan of in the pharmacy, just because they're pretty inert. The companies make a lot of money. They don't do very much. They're just a glorified saline solution. You want to take something that has sodium hyaluronate. Sodium hyaluronate is a product that actually nourishes your cornea. It will cushion your cornea and nourish it. They use sodium hyaluronate post-surgically after cataract surgery. So that's a good thing to look for, sodium hyaluronate. That's a good drop to take alongside with your lantanoprost and medriosil or timolol.
Thank, thank you. We've got lots of questions now. So, and we only have about, well, we have about 40 minutes almost. And you've sort of touched on this question a little bit. What's the current thinking on omega-3 supplements for dry eyes? The literature has mixed reviews on risks and benefits.
Well, omega can hurt you. So whoever says it's not worth it, I say if it's, I'm a big fan of omega. Omega really, really helps break down I was talking about those two glands in your eyes, the meibomian gland that produces the mucus. As we age, the meibomian gland produces a much thicker, pasty, mucousy product, and that becomes blocked, and it really affects your eyes. And omega will loosen that up. Omega will most definitely loosen up that mucousy tear film and help it have a better quality of tear. I'm a big fan of omega. If you're not a fan of omega, I don't know why, because it doesn't have any really bad secondary effects. Anything in excess, of course, is not good. But if it can't cause any harm, omega is good for your general health as well. So simply put, I'm a big fan of omega supplements. Now, there are a lot of omega supplements that have a lot of fillers and don't really have really great benefit, and they just use it, of course, to make a lot of money. So speak to your eye care professional. There are companies that are exclusively catering to the eye care field, and they make omega vitamins that are very, very efficient for the general health of your eye.
Thank you. Next question. I've been told I have baby cataracts. Not sure what that means.
Just the baby cataracts, just the beginning of the cataracts. As I mentioned earlier, everybody will get cataracts, so it's probably early stage cataracts instead of baby cataracts. Early stage cataracts. I see cataracts dozens of times every day, even people in their 40s. So I just mention it so you know. So if anybody ever mentions it after, say, yeah, I know, you just follow it. And you just want to, if you have the early stage cataracts, UV protection, good sunglasses, antioxidants, have a good diet, protect your eyes. Vitamin E, vitamin C are good antioxidants. The blueberries, the grapes. A lot of these sunglasses, unfortunately, there's a pretty well direct relationship between the cost and the quality of a sunglass. If you're going to go to the dollar store and buy a $6 or $4 pair or $10 pair of sunglasses, that a lot of times is worse than having no sunglasses. And you ask why? Good question, Chris. The reason for that is you have a dark lens, and my water bottle has UV protection. But there's three types of UV. There's UVA, B, and C. Any piece of plastic will have protection against UVA. But the dangerous rays are the UVB and UVC. So you want to have sunglasses that say UV, B, and C, not 100% UV, because 100% UV is a bottle of water. So what am I getting at? You buy a pair of glasses for $8 or $10, and they're dark gray, and they have no protection against the UV, but they're dark. So your eye is tricked. It's fooled that now you have a dark lens, so your pupil gets bigger because it's dark, and more of the harmful rays come in and cause more damage than if you don't have sunglasses. Your pupils get smaller, they constrict, and it naturally protects your eyes against any harmful rays. So UV rays are number one cause of a lot of problems, particularly the cataracts, not only cataracts, but the front surface of your eye. But make sure that you're paying for a quality lens. Now, when they say the lenses are polarized lens cuts out glare. That's all it does. It doesn't give you more protection against UV. Light travels in a wave. It's electromagnetic. It travels in a wave, different wavelengths for different colors of light, like you see on a rainbow. But once that light bounces off a surface, now that light is out of phase. And we call that light out of phase glare. And what a polarized lens does, it just cuts out the glare. Now, if you like to fish, if you're on the water, if you're on the snow a lot, where there's a lot of reflection off the surface, that polarizing lens will cut out the glare. It'll make your eyes happier because you'll see without glare. However, it won't give you any more protection against the UV. Some people swear by polarizing lenses, some don't. That's just a preference. If you're on the water a lot, it's much better to have a polarizing lens, especially if you want to see that where that fish is.
All right, thank you. Now I'm going to try and group a couple of questions together about macular degeneration. So the first one says, my ophthalmologist has told me that at age 78, I have the very beginning of macular degeneration. I've just had cataract surgery in both eyes. I've been taking Arid 2X, 2 times Arid 2 twice a day, and eat healthy with lots of colorful veggies. I've heard that about 15% of people, the ARIDs 2 are contraindicted. Where can I get genetic testing to see if I'm one of the 15%? Maybe you can explain also what it means with contraindicted. And then the other question about macular degeneration is, okay, what can you talk about how to slow the progression of macular degeneration? At what point can we know whether it is wet or dry macular degeneration?
Good questions. Okay. The AREDS 2, the AREDS is the Age-Related Eye Disease Study 2. That's what the AREDS 2 is. And the pill that that person is using is made by PreserVision. There are many different pills for the slowing down, not the reversing of macular degeneration. It won't reverse it, but it will definitely slow it down. My favorite is the PreserVision. There's Vitalux, and you can get just generic pills that have lutein only. You can buy those vitamins that are lutein only. I like the PreserVision, and what the PreserVision is doing is it's giving nutrients to the back of the eye where the back of the eye is starting to degenerate. So what was the question again? So
What can
basically,
you do to slow down the
what to
macular?
do to slow down is diet, um, good green leafy vegetables, good colored vegetables. Don't smoke. Take lutein. That's really good. Take it twice a day. And your eye care professional here. I got one right here. Your eye care professional should give you one of these grids. It's called an Amsler grid. And this Amsler grid should be used with one eye only. You cover one eye and you look at the black dot in the middle. While you're looking at that black dot in the middle, are all the lines straight? If any of the lines produce a distortion, then the macular degeneration is starting to kick in. And I'll show you what the distortion looks like. This is what you want to rid yourself. You don't want to have, I don't know if you can see this, Chris. You want to avoid distortion like that. Can you see that?
Yeah, a little bit. It looks like
Okay.
it's a bubble popping
Right.
up. Yeah.
So basically, I'm sure your eye care professional has these pamphlets about macular degeneration. Um, you want to go for frequent follow up care, diet, protect yourself against UV light, and just go for follow up all the time. Now, there's dry macular degeneration and there's wet macular degeneration. Dry macular degeneration is the back surface of the retina, the back surface underneath the retina. There's sort of like what we call drusen. Drusen is sort of like a breakdown of the of the composition of the retina. It's like almost like goblet cells, like fatty tissue, starts to push up into the macular area and cause the macula to have distortions. That's a dry. That's much easier to prevent and to manage and to monitor. The wet macular degeneration is when the degeneration comes in with those drusen bodies, but blood vessels start coming in with them as well. Hence, it's called wet. And those blood vessels start to hemorrhage because they're very brittle and they're very fine. Excuse me. And when those blood vessels start to break up and they start to bleed, that's when you start losing your vision and you have a lot of distortion. You want to prevent that. The only way to prevent that is with injections that most ophthalmologists know about. There's all different types, and you have to get injections for that. Now, there's a new um, there's a new approach now that is really good. It's called Macumira, and this Macumira procedure is very effective in preventing the progression of dry macular degeneration. I don't have that in my office. If I started my practice 40 years ago, I'd probably get it. I'm not getting it now because you need a special department just to have it. But I can tell you that there's an office in town that has it called Macumira, and they're the eye docs on Kilbourne, Dr. Annie de Grosier. You can ask for her and tell her that you listened to a presentation. I advise people, if you want to try or get referred to that office, they have what is called Macumira, and it's very new, and it's proven to be very effective in preventing and slowing down the advancement of dry macular edema, which is the first of its kind. Wet, we've always known we had aggressive ways to slow it down, but the only thing that we had for dry was diet again, and these pills of lutein, zinc, and whatnot. And then they were saying that there's some 15% people don't believe in it. Again, it's like omega. It does. These pills can't really do much harm. Now there are some studies. They took out. These pills used to have aluminum in it, which people were saying is bad with for Alzheimer's and whatnot. There are a couple products in there, zeaxanthin, that can cause secondary effects in terms of memory and Alzheimer's. They're doing all kinds of tests. The results aren't 100% out, but there are some secondary effects with these. So if you want, you can just take lutein, pure lutein on its own. But again, a lot of these companies have fillers, and when they say it has lutein, they trick you just for the almighty buck, which drives me mad. So I hope that helped.
Yeah, thank you. Just a couple of questions back to the solar, the sunglasses. I guess the freebies that you get as swag,
Yeah.
unless they say, yeah, don't pick them up, because they're going to do more harm. And it's important. that is you're saying that the recommended sunglasses should say UVB and UVC on them somewhere.
Exactly. If it says
Uh,
100% UV, that's 100% UV.
right. And the sunglasses marked with solar shield, are they effective? Somebody else says the tint that we put on prescription glasses, that's worth it.
Oh, prescription sunglasses are for sure you're going to get the UV. Now, those solar shields, there's a couple makes, so they're good. You know, the ones that you put on top of your glasses, they're called solar shields. The company Solar Shield itself is a good one. There's a lot of, again, uh, artificial ones or knockoffs that are more dangerous than good, more harmful than good.
Okay, the next one. I'm waiting cataract surgery, and OHIP covers basic diagnostic surgery and basic IOLs. Are premium IOLs, enhanced diagnostic techniques have assisted, laser assisted, worth the additional expense? And somebody else asked a similar question about, laser, um, uh, our laser, whether laser, how helpful that is.
Okay, great question. The first one, the laser one's a totally different question. That's a good question. Um, it depends how intricate your prescription was before. Um, yes, an enhanced lens has less aberrations because what OHIP pays is pretty well for cheap IOLs is an intraocular lens. So many of the IOLs are basic. They're all good quality, but if you want to have an enhanced IOL, I think it's worth it. You don't have to go to the Mercedes Benz or the Ferrari. You can go with a Cadillac, an Audi, or whatever, and that should cost about $300 more. There's a lot of offices that are making a lot of money on these IOLs and they don't really need them. So I guess the bottom line is you got to trust who you're going to. Unfortunately, it's like everything. There are people who will take advantage of people who don't know, and it's sad, but it's the bottom line isn't the money. So now, in terms of laser, I don't know exactly what laser with after cataract surgery or laser to correct your vision. Maybe you can elaborate more on the question.
Okay. In the meantime, what are ocular migraines and what causes this?
Ooh, good question. Ocular migraines, basically what's happening is in the brain when you have blood flow and the blood flow constricts and expands, basically when the blood flow rushes in and comes back, you'll get what is called an ocular migraine. You can see all kinds of aura. You can see like a kaleidoscope of colors. You can see all kinds of visual, uh, I'll call hallucinations. They're not hallucinations, but you'll see all kinds of different auras. And then all of a sudden you'll get a headache because that's basically the eye telling you that the blood flow is changing and can cause ocular migraines. Um, it's a big difference between a retinal detachment, which I didn't touch on. Sorry, that's good segue for retinal detachments. Now, a retinal detachment is actually when the retina is is torn, not a vitreal detachment. The vitreous, remember the thick jelly in the back of the eye, when that gets shrinks and it pulls on your retina, that's when you see kind of flashes of lights. That's not a retinal detachment, that's a vitreal detachment. But a retina detachment is when you see pinpoints of light like you're seeing fireworks. They usually stay in one place. They don't move. Like a lot of people see these zigzags that move or flashes of lights that move is different. That's in the family of floaters, which we talked about. But the most important thing is if you see as though someone's closing the curtain in front of your eyes and you're losing your whole field of view and it doesn't come back, that's the retina pulling off. That you go right away to an eye care professional to get that looked at. Back to the retinal migraines. Retinal migraines are happening so much more often now with the advent of the computers because what's happening is people are focusing on their eyes, focusing with their eyes close all the time. and your muscles are always in a state of focus. So there's a spasm of those muscles all the time, which those muscles, which is the color, which is the front surface of the eye, your iris, the color part of your eye, the iris, the iris there is really a muscle. And that muscle is used to focus. Now, when you're in front of the computer for 6 hours, 4 hours, 3 hours, and your muscles are just tensing up, that muscle's pulling on your eyes, and that can cause an ocular migraine because it's like a spasm. So if you're going to be in front of the computer for 2, 3 hours, that's fine. But every 20 minutes, stop, look far away for 20 seconds. Good reading habits. I explain this a lot with the university kids because they start getting headaches and they're prescribed glasses. And you don't need to be prescribed glasses. You need to just be explained what's happening and relax your eyes. So if you're getting ocular migraines, what medications are you taking? Are you taking aspirin? Are you taking blood thinners? Are you taking things like that that can cause changes causing ocular migraines? Are you on your phone for 2, 3 hours without taking a break? Lack of sleep can cause ocular migraines. It's a generic term, and a lot of people jump on the bandwagon and say, oh, it's an ocular migraine. But a true ocular migraine is just caused by fatigue or stress or any other stimulant that causes a spasm of the blood vessels or a spasm of the muscles.
Okay, thank you. Are styes more frequent with age? And if so, what can we do to prevent them?
Ooh. So a sty is happening. Remember, I showed you those two types of glands. You have one gland that produces uh, the oil, and behind there, there's one called the meibomian gland that produces the mucus. Is it more prevalent with age? No, it is not. Again, omega. Omega is really, really good to prevent styes. Another thing that's very good if you have time and you have patience is warm compresses. Face cloth in hot water putting on your eye is better than nothing, but all the studies are showing it doesn't really do anything when you have the sty already. But if you want to prevent, you can go to the pharmacy and for $10 you buy those masks that you put in the microwave. 10, 20, 15, 20 seconds in the microwave, put it on your eye, and that heat will open up those mucousy glands and let everything drain. And the buildup of the mucus will not basically cause the sty. The sty is just a blocked gland where the mucus is like blowing a balloon and the balloon has nowhere to drain. So that hot compress will open up the gland and let everything drain. Is it more prevalent? With age? No, it's not more prevalent with age. But good eye health is good. I mean, hot compresses. I mean, in the shower, letting hot water go on your eye doesn't do much, doesn't do harm. But if you really want to prevent stuff like that, get a mask or get a hot compress and get a face cloth in hot water, or rinse it off, put it on your eye for 10, 15 seconds, do it 8, 10 times. But I tell people who have a sty that's not the way to go. You get one of those compresses. And again, diet will prevent styes for sure. Anything that has good fat, salmon, almonds, nuts, beans that have good omega content.
Okay, thanks. I'm going to combine a couple of questions where we only have a little more than 15 minutes. We have lots of questions, which I probably won't be able to, everybody won't be able to answer them. But why do some people have eyelashes grow inside the eyelid? And can seniors expect to experience a progressive drooping eyelid that can affect vision?
So, yes, the droopy eyelids are very, very normal aging process, and basically like I said, the elasticity of your lids become less, and the eyelids droop, and it will only cover it unless it's really affecting your vision. There are a couple plastic surgeon ophthalmologists in town who do that work. Um, a lot of people do it for cosmetic reasons, but that's a very, very normal aging process, the droopy lids. It's not indicative, usually, not indicative of any health problems, just indicative of maturing.
Okay.
And the other part of that question was the eyelashes growing into the lids. So what happens is that, again, the tonicity, the elasticity of your lids become less, and sometimes it can turn in, and sometimes it can pull out. And if it turns in, the eyelashes will rub against your eye and cause a lot of irritation. There's a simple surgery that you can do to tighten your eyelids. Um, I see many of my elderly patients come in once every few months, and I pluck out 2, 3 eyelashes, and they're good for a few months. Normal, nothing bad, not indicative of anything bad.
Okay. Next question. What important factors to consider when cataracts are diagnosed, but still there are PCS symptoms, whatever PCS is?
PCO,
They wrote PCS, but I don't know. Um,
posterior capsular, I don't know what's PCS.
okay.
Ask him to write back.
Yeah, can you write back? I'm not sure we'll be able to get to it, but we can try to. Um, can severe dry eyes damage permanently your eyesight?
Ooh, if it's really severe. Now remember, there's a direct relationship between dry eyes and arthritis, because your cornea is connective tissue. Your cornea is lamellar tissue interfined. So the cornea is very, very much associated with arthritis. So if your eyes get dry, really, really dry, and they're not lubricated, you can cause an ulcer on that eye. You can cause a dystrophy on the eye. You can cause degeneration of that cornea, and it's pretty painful. You'll know that you're having problems. But if you let it go and that erosion or that dry eye turns into something more severe, it can cause, and it gets cured, but you'll always have scar tissue there if it's not cured properly. And that can cause long lasting of secondary effects. There's no question. It's rare because most people will get their eyes checked and have it resolved. But if it's not, the answer is yes.
Okay. PCS, back to that, that means post-concussion symptom. So there's a
Oh,
couple of questions there. And also, are you talking about omega-3 or omega-6 when you say omega?
omega 3 6, both good.
Okay. Thanks.
So posterior concussion syndrome is not necessarily an aging factor outside our realm of today, but that's fine. Man, the concussions are so much more prevalent now than before. Um, I don't know what you want me to address with that.
Okay.
What was the question with PCS?
How do you treat it?
Oh, it depends
Uh,
what the symptoms are.
what are the important factors to consider when cataracts are diagnosed, but there still are post-concussion symptoms? That's what it is.
Cataracts and PCS, posterior concussions, are not really related. Um,
Okay.
somebody that has a concussion doesn't the cataracts were not caused by the concussion. Let's put it that way.
Okay. Um, Hi, you and Dr. Bastian treated my mother way back. I was diagnosed with PVD, posterior vitreous detachment, a few months ago. Will this go away eventually or get worse?
Oh, if I can tell the future, you're going to have to zoom me in my private island in Bali, because if I can tell the future. Um, PVD, posterior vitreous detachment, is like I explained, that vitreous um, is drying up, and it's not really touching the back of the eye. And when that vitreous, it pulls. You have to be the best caretaker for yourself and just watch it. And if you're seeing those flat, because with PVD, as you start getting flashes of lights, and you want to make sure that that vitreous doesn't pull the retina off. It happens rarely, but PVD is becoming much more prevalent. How do you prevent it? You really don't. Will it get better? Probably not. What you can, if it doesn't get worse, your brain adapts to those floaters that float in the eye. Your brain ignores them. At the beginning, it really bothers them. People come in a panic. I'm seeing this little bug that is floating in front of me, and it's driving me crazy. And your brain adapts to it. But is it going to get better? I hope so. And if anybody tells you a definite answer, you're getting the wool pulled over your eyes, because nobody can
Okay.
tell. Nobody could tell.
All right. How important, and this is just a humidity question again, how important is humidity from a humidifier for dry eyes? I guess what they mean is, does that help with dry eyes?
100%. 100%. The more, like, if
Okay.
you're having dry eyes, you want your eyes to get moisture, and humidity is moisture. So yes, it's really good. It's really
Okay.
good. It's good for everything.
When would an optometrist prescribe glaucoma eye drops if there is no increased eye pressure?
Oh, you have normal tension glaucoma. Glaucoma is not only when the pressure increases. There's genetic factors. You can have normal tension glaucoma where the pressure is normal. We have a new machine now. It's called an OCT. It's basically like an ultrasound for the retina. So if I look at the optic nerve and I have a suspicious optic nerve, I will look underneath the retina to see if there's any damage to the optic nerve, if there's any deterioration. That's one way of looking for normal tension glaucoma. You also want to do a visual field. You want to measure the messages going from the optic nerve to the back of your brain. Because if the optic nerve is degenerating without elevated pressure, that visual field will pick up any of the deterioration of the optic nerve, and that glaucoma, normal tension glaucoma, should be treated. So glaucoma is not only when there's elevated pressure. You can have
Okay.
glaucoma without.
There's a question about explaining stigmatize, what that means. And then there, if you want to do that, answer that, there's also, I'm going to scroll down and find there's another one.
Astigmatism?
Yeah.
Okay. So astigmatism is a big word saying that your eye isn't round. Here's a ball. It's spherical. It's the same power throughout. If I now squeeze that ball, the power here is different here. It's like a football. So it's a football versus a tennis ball. Astigmatism is just a big word saying that your eye isn't round. See, the bigger the word, the more you could charge. That's a joke. That was a joke.
Okay.
So astigmatism is just a big word saying that your eye isn't round. Everybody has astigmatism. A little bit, a lot. That's it. And having astigmatism, yeah, because there's two different powers in your eye, it doesn't focus together on the brain, and your brain can't focus, causes a lot of eye strain, but it's not indicative of any problem.
Okay. And somebody said here, and I don't know if this is a question or not, it says, why does the shape of the lens change and cause astigmatism? I don't, that's probably just aging. And prescription changes to move focus on the cylinder and lower the strength of the prescription. So,
So a lot of times, if the prescription changes a lot, and a stigma and the shape of the eye changes, or the lens, or the cornea, or whatever, and your astigmatism changes a lot, now your brain has to code that information, and sometimes the brain can't adapt to that. If your astigmatism is like this, and now your astigmatism is like that, your brain's going to go, whoa, this is way too big. And that's where it takes the experience and the expertise of the optometrist to know the right prescription.
okay. I think we have room time. Well, I don't know. We've got 6 minutes left. You probably have to go at 2:30.
Yeah, I'm good.
You're good? Okay, maybe we'll have a few more questions. We'll give you another 5 minutes. I know Antoine will cut me off. I'm retired. I just have to clean the house before my wife comes back. So, I was diagnosed with pigment dispersion syndrome many years ago. Does this condition get worse with aging? What should I be expecting in terms of progression?
So your iris is the muscle of the eye, and your iris is pigment. So the pigment is sloughing off. It's like when you scratch your skin or you scratch material, that pigment can block the drainage of the liquid in your eye, which can elevate your pressure. So that's something that should be followed very carefully, and it can get worse. Will it get worse? Can't tell you, but it can, and that should be followed very routinely.
Okay, thank you. I'm awaiting cataract surgery, and OHIP covers basic diagnostic surgery and basic IOLs, whatever that is. Are premium IOLs, enhanced diagnostic techniques, laser assisted, worth the additional expense?
You asked me that already.
Okay. I guess I didn't delete it anyway. Um, my ophthalmologist wants me to have ultra wide field fundus autofluorescence photography tests every year, and it's not covered by OHIP. Do I need one every year? Yes or no?
Oh boy, it depends on your ophthalmologist. If he thinks you need it because maybe there's some leaking blood vessels or there's reason to do it, I would trust him. If you don't trust him, get another ophthalmologist. If he thinks you should have it done, have it done.
Okay. All righty. What are your thoughts on elective refractive lensectomy? Is it effective and safe?
So the big thing up until a few years ago was laser surgery, and laser surgery would correct the cornea. The cornea, which is about 70% of the power of your eye, you reshape the cornea, and it changes the power of your eye, and you don't need to wear glasses. The new kid on the block now is don't touch the cornea, but you open up the cornea, you go in where your cataract lens is, or there's no cataract. You take that lens out. So before the cataract is even maturing, you take that lens out, and that corrects, and they put another lens in, and that corrects your vision. It's it's not very invasive. It's a good thing, depending how old you are. If you're 20, don't do it. If you're, you know, in the later decades of life, 50, 60, 70s, and the cataracts are starting, it's a good idea to do it. It's, again, preference. And again, it comes down to the bottom line is, how well do you trust your eye care professional? You have to, I mean, do they have, you know, do they are they taking good care of you? My byline that I use whenever I have a staff meeting, or my staff know it all the time, is patients don't care how much you know until they know how much you care. And as long as you are being priority number one, and not my office is being priority number one, that's the key. You got to just trust him. And if he thinks it's better for you, go with him. If you don't trust him, get someone else.
Okay. Couple of glaucoma questions. I've had glaucoma in my later since my 40s. I've been using I later became diabetic and have become asthmatic. I've been using Betopic for glaucoma since my 40s, but it's no longer manufactured. I had no issues using Betopic and Ventolin. I'm in a position between using Timoptic and Lantopost.
Lantipros, yeah,
Okay,
Xalatan.
can I keep on using beta blockers and Timotec? I had no side effects with Betopic, and she says, the person says Lantanapa, whatever, is a,
Lantanopros.
is a different family of drugs. And the other question is somebody wants to know if Zalacom is good for his treatment of glaucoma.
Again, first of all, Xalacom, Xalatan, they're different modes of operation. Some decrease the output, some increase, some decrease the input of liquid, some increase the output of liquid. Each one has different effects of what's causing the glaucoma. But the medications, there's a lot of glaucoma medications that are contraindicated if you have asthma or heart problems, that your doctor should know that there are some of the drops should not be taken if you're asthmatic.
Okay. Somebody wants to know also if selective later trabea, trabecular.
Trabectomy.
Yeah, there's a reason why I was a history major, not a science guy. SLT treatment for glaucoma has
Glaucoma.
side effects. How many times can you have this treatment without affecting the eye?
Good question. What that is doing is, again, um, where the liquid drains, it could be blocked, and the trabectomy pretty well cuts a hole in there to let the drain. You can have it done many times before you shouldn't do it too many times.
Okay, is there any approach to alleviate excessive tearing? Um, yeah,
What's causing the excessive tearing? Is
that's
it
all
because
tearing. That's all.
is it the lid is pulling away and it's not draining and it's overflowing? Is the hole where the tears drain blocked because of dry mucus or just because it's blocked? Is it caused because there's a scratch on your eye and you is it caused because you have allergies? Is it caused because of medication?
Yeah.
What's the cause of excessive tearing? That's the
Okay.
key.
All right. Two more questions because I know you've got other things to do. This has been very popular. We have there's like 20 questions still. So we've had a total of over 50 questions. So obviously this is a topic of interest. Um, says somebody wanted to know, my eye doctor suggested MacuHealth capsules that are available through his office. It's costly. It contains lutein, mazoxanthin, and Zexa, whatever,
Yes.
Xanthin. Are drugstore brands okay, or are the drugs available for coverage under our benefit plans?
There's a lot of private companies that sell only to optometrists, and they're designed just for the eyes. Um, Again, the bottom line is, do you trust your eye care professional? There are a lot of products that you cannot get in the pharmacy, and a lot of the pharmacy ones are not as efficient as the private ones. If your optometrist is selling in his office, I am sure that the quality is better from your optometrist than elsewhere. Now, something like Vision, you can get Vision in pharmacies, in Costco, and Walmart. Apples to apples, go where it's less expensive. But something that your optometrist has that you can't get elsewhere, I'm sure there's a good reason for it, and I support that.
Okay. Um, we have somebody wants to know about a question on changing medication when it comes to glaucoma.
Speak to your eye care professional.
Okay. All righty. Okay, boy, there's so many questions. Does AMD always, this is a quick yes or no question. Does AMD always start as dry?
Ooh,
Early?
no,
Yes, no.
no.
Okay. All righty. Um, boy. Okay, I think we're getting some nice comments here, and there's just um oh, somebody wants anyway. Uh I think we're gonna have to end there. I mean, we could go
Okay.
on. There's still 19 questions. Oh, there's one. This is a good one that I just want to ask. What are the drops you should not take if you have asthma?
Okay. Well, first of all, a lot of these drops in the pharmacy, the Visines and Murines, I don't let anyone take them because what happens is these they have a drug called phenylephrine and it causes your blood vessels to shrink. And what happens, it gets the red out, but then what happens is the red it bounces back and you become addicted to it. You got to keep on taking it forever and ever. So a lot of these get the red out drops are really really horrible. Which you got to look at a lot of the beta blocker drops that have vasoconstrictors in it are very bad for asthma and also very bad for heart issues, high blood pressure. So just standing on one foot, I'd have to go through that a little bit more detail. So it's a good question. You can call the office or ask your eye doctor that you should avoid.
Okay. All righty. Well, thank you. We could go on for another half hour, an hour, but people have other things to do. But this has been really great. I want to
Chris,
thank
thanks
you.
for asking me for this. This is
Oh, you're
great.
welcome.
So
I'll,
next year this time I won't be available. I'll be at the parade in Toronto for the
okay,
Blue
well, we'll
Jays.
just have to have a spring session then.
Okay, okay.
Yeah, the parade. Hopefully it's a leaf. I mean, not a leaf. It's a.
Oh, well, what did you just say?
I
Leafs,
said,
no
I,
leaves.
no, I know
Okay.
you're from Montreal. Anyway, thank you for your participation, everybody. A big thank you to Dr. Harry Prizant for his informative presentation. Please look out for our follow-up email that'll contain the recording for today's session. I also want to let you know that our mega recruitment drive is on now until November 21st. Each time you refer someone to the association and they join, you'll be entered into our draw for some great prizes, including a grand prize of a $20,000 travel voucher courtesy of Colette Travel and $5,000, sorry, spending cash courtesy of Bel Air Direct. The more people you successfully refer, the more chances you have to win. And speaking of Colette, there's going to be sponsoring two travel shows next Friday, the 14th, at 10 a.m. and 1 p.m. And it's going to be out in the Pineview Golf Course on Blair in Gloucester, the former Gloucester. So uh, remember, you can invite non-members to attend our webinars and try us out as a guest. To register for upcoming webinars, please visit the Ottawa branch website at nafrottawa.com or nafrottawa.com. Thank you to everyone. Merci beaucoup, Megwish, and thank you. What a great site. So I'm gonna have lots of questions when I see you again.
With pleasure, with
All
pleasure.
right.
Avec plaisir.
Okay. Thank
Okay,
you.
thanks. Bye-bye.